Good morning, and thank you for joining us. My name is Jane Morgan, Investor and Media Relations Manager for ReNerve Ltd, an Australian biotech creating innovative treatments for peripheral nerve injuries, nerve repair, and regeneration. Today, I'm actually joined by a guest of the company who has first-hand experience working with ReNerve's initial product rollout in the United States. Dr. Wil Adams is a board-certified, fellowship-trained foot and ankle surgeon based in the state of Indiana with experience in well over 5,000 procedures. Dr. Adams is also an educator, researcher, and an orthopaedic device consultant. And he has also just finished presenting some of his latest research at the American College of Foot and Ankle Surgeons Conference for 2025 in Phoenix, Arizona this week. Dr. Adams, thanks for joining me.
Thank you for having me, Jane.
So, Dr. Adams, this work that you have done and that you're now presenting your findings on is related to the NervAlign Nerve Cuff, which has been developed by ReNerve. Now, in this study and with your co-authors, you've been testing the efficacy of the NervAlign Nerve Cuff, which could more broadly be categorized as a nerve graft or even a nerve wrap, as it did in the research. So, for those who aren't familiar, can you briefly explain to us what a nerve wrap is used for when it comes to peripheral nerve surgery and what that procedure actually involves to begin with?
Yes, thank you. So that's great, Jane. The nerve cuff or the wrap or graft, as it could be considered, is a thin membrane, if you will. It is derived from porcine pericardium. It is a very thin membrane. And what's novel about the membrane and why it is important and it has efficacy in peripheral nerve surgery is that because it is thin, but at the same time still somewhat durable, it allows a surgeon to take that membrane or that wrap and to basically circumferentially protect or cover a peripheral nerve. And because of the quality handling properties of that tissue that has been prepared by ReNerve, it still allows people to sewing through it, which gives it the benefit of good handling for the surgeon. But at the same time, the point of using this product in peripheral nerve surgery is to prevent the nerve from becoming entrapped in the tissue that you have just pushed away from it. And so what often we see when we do peripheral nerve surgery is that there's this goal for a surgeon to take a nerve that has potentially been entrapped or pinched. And when you are trying to push that tissue away from that nerve, the last thing you want is for during the healing process with the host for them to redevelop this pinch point or this area of impingement or irritation to the nerve. And so essentially the nerve cuff is helping prevent that.
So, this study between two groups of patients that underwent foot and ankle surgery, 23 patients in total, is that correct?
That's correct. The study was a retrospective study that we performed that included 23 patients, 24 feet or ankles total. And the average follow-up time was 9.3 months. The max follow-up time was about 3 years. We retrospectively called these patients and looked at, from a questionnaire basis, how they did post-operatively in regards to their pain scores. We recorded those pain scores in their first 3 months of follow-up after surgery as they followed their typical post-operative course. But then again, retrospectively, we formed a questionnaire and went back and through a phone conversation, interviewed each of these patients that were enrolled in the study to compare the control group to the treatment group.
So, regarding the results, what you found in this process was that after their procedures, the patients who received treatment with the nerve wrap actually reported significantly different scores for pain than those that didn't receive treatment with the wrap. Is that correct?
That is correct. What we found, Jane, was that in the 14 patient treatment group versus the 10 patient control group, or 14-foot treatment group, I should clarify, in the 10-foot or 10 ankle control group, that the pain scores were notably reduced in the patients that were in the treatment group. In the group that received the nerve cuff, the patients on average reported that the mean post-op pain score was 0.4 versus 3.3 for the control group. And so that is statistically significant for us surgeons to understand that we have this product that can improve a surgery that we're already doing regardless.
Dr. Adams, what does a technology like this, one with positive outcomes for patients when it comes to post-surgery pain in particular, I mean, what does this actually mean for peripheral nerve injuries and this type of surgery?
I think what the nerve cuff means for peripheral nerve surgery and for the surgeons themselves is that it helps reduce the uncertainty that all surgeons see within peripheral nerve surgery. It is a subspecialty within many different specialties within medicine. You see plastic surgeons, orthopedic surgeons, podiatric surgeons, neurosurgeons, of course, performing these types of procedures. And I think most of them would agree that, again, nerve surgery can be a little unpredictable. And I think that the nerve cuff helps remove some of that unpredictability, as we demonstrated with our studies, by virtue of it reducing post-op pain scores.
Look, we're really thrilled to hear that your first-hand experience with this new technology has been positive, and especially the patient outcomes, something as significant as their pain following major surgeries improving as a result. So, for those of you who'd like to find out more about ReNerve or the pipeline of multiple different nerve repair and regeneration products that the company is developing, please feel free to reach out. But thank you for your time today, Dr. Adams.
Thank you very much, Jane.